अरवा मिलाद की बहार से मौसम बदल गया आमद के नग़्मे सुन के हर एक दिल मचल गया सल्लल्लाहु अलैका या रसूल अल्लाह।
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the Medical Files, brought to you by the Islamic Medical Association, your weekly health segment where we go above and beyond and dive into the health issues that truly matter to you and your loved ones. We're broadcasting live tonight from our Durban studios on Radio Ansaar, and we also welcome the listeners of Radio Islam, Channel Islam, IFM, Voice of the Cape, Sirius FM, and Radio 786. I'm your host, Dr. Zakariya Islmail, medical officer based here in Durban, and I invite you to stay with us for the next hour or so as we talk about a topic that is often whispered about, but rarely spoken about openly. And tonight we are shining the spotlight on prostate diseases. Now, let me ask you this. How often do men ignore getting up multiple times at night to urinate, brushing it off as just old age? How many silently worry about blood in the urine but never mention it out of fear or embarrassment? How many families have lost fathers, brothers, husbands to prostate cancer simply because it was detected too late? Well, the truth is, almost every man will experience some form of prostate problem in his lifetime. Yet the stigma, the fear, and the silence keep men from seeking help until it's too late. So the prostate may be a small gland, but its diseases can carry huge consequences, ranging from discomfort and infections to life-threatening cancers. So tonight, we are going to strip away the silence. We're going to get real about men's health. We're going to ask the questions that men are often too shy to ask, and we'll give you the answers that could potentially save lives. And joining us for this important conversation is our esteemed guest, Dr. AVIKAR Singh, specialist urologist here in Durban, who has helped countless men with prostate problems regain their health, confidence, and dignity. Welcome to Medical Files, Dr. Singh, and thank you for being with us tonight.
Assalamu alaikum. Thank you, Dr. Ismail. Thanks for having me on the show. Good evening to the listeners. Prostate disease is something that almost every man will face in some form within his lifetime, whether it's an enlarged prostate, infection, or cancer. Yet because of stigma, many of these men keep quiet until their problems are quite advanced. Today's conversation is about breaking that silence, giving men the facts, and showing them that early help is simple and life-saving. So thanks for having me on.
Our pleasure. And listeners, remember that this is your show too. So if you have any questions, thoughts, or personal experiences that you'd like to share with us, send us a WhatsApp on 060-904-1056. That's 060-904-1056. Don't wait for tomorrow. Don't wait until it's too late. Tonight is your chance to learn, to ask, and to take control of your health. So stay tuned as we explore what the prostate is, the diseases that affect it, how they can be detected early, and what treatment exists today. This is Medical Files, and tonight we're choosing truth over taboo, awareness over fear, and prevention over regret. So, Dr. Singh, let's start with the basics. What exactly is the prostate, and what role does it play in men's health?
So the prostate is a small gland, usually a small gland, just below the bladder. It's often described as being walnut-sized, so it's not very big. And it's usually wrapped around the urethra or the urine pipe. Often describe it as a round donut around the urethra. Its main job is to produce fluid that protects and nourishes the sperm. And because it sits on the urine passage or intimately associated with the urine passage, any swelling or disease affecting the prostate can affect both urination as well as sexual function.
Mm-hmm. And what are some of the common diseases that affect the prostate?
The three diseases that we see most commonly are benign prostatic hyperplasia, or BPH, This is a non-cancerous growth that occurs often with age, and it causes urinary problems, urinary symptoms, most commonly weak stream, frequency, so feeling like you need to pee quite often, as well as waking up at night to urinate, nighttime urination. The second most common condition is prostatitis, which is inflammation or swelling or infection of the prostate. And this is often seen in younger men, can also cause fever, burning when urinating, as well as pain in that pelvic region. The least most common condition is prostate cancer. However, this can often be the most serious. It's the most common cancer in South African men, often silent at first, but very treatable if caught early.
So you mentioned that it's the most common. How common is it compared to the rest of the world?
Yeah, so it's not as common as the rest of the world. Unfortunately, in South Africa, we are a bit behind on detection. So from what we are finding in the patients, about 1 in 16 South African men will be diagnosed with prostate cancer at some point in their lifetime. This compares with 1 in 8 men worldwide. And I think this is because we may not be picking up enough patients that actually do need to be detected. There's about 5,400 deaths each year in South Africa from prostate cancer. And in the last 15 years, the amount of patients we're picking up has more than doubled in the last 15 years. So we are increasing in what we're picking up. And it's likely going to get even higher, those statistics.
And do you think it's picking up because we are now starting to detect it more easily than we used to before?
Exactly. In the past, we did not have, so access to healthcare was not as readily available for most patients. Detection in terms of blood tests as well as, appropriate evaluation, also because awareness of doctors and healthcare professionals as well as patients are seeking healthcare more often to detect these conditions. Additionally, with modern ways of detection, such as these new scanning investigations, MRIs, and other imaging modalities, we're also detecting more cancers as a result.
I see. And what age then do men typically start experiencing prostate problems? Is there a typical age group?
Typically, it's a disease of older ages, usually after the age of 50. And this is specifically BPH that I'm referring to. Prostatitis, so the infection or inflammation of the prostate, can occur at any age. We see it in men in their 20s, in their 30s. Cancer risk steadily increases with age. We're seeing men at younger ages now with prostate cancer, so even men in their 40s that have prostate cancer, but the majority are 45, 50 plus. Men with a family history or men with a family history of prostate cancer or of African or Indian descent are generally at risk of cancer at younger ages, and looking for these things from between 40 and 45 in those groups, 40 and 45 years old, and from 50 years old in the average risk men.
So most often the elderly, the above 50 age group, but it can occur in younger men as well, as you mentioned.
Yes, 100%. So there's two different categories here. It's important to differentiate the two. The BPH, the benign condition, can happen generally older than 50, but we are seeing younger men with it, especially men who are taking testosterone therapy. So it actually accelerates the growth of the prostate when taking certain supplements, and we're seeing those men at younger ages now. With prostate cancer, generally older than 45, but in patients that are at higher risk, genetics, we're seeing men as young as 40 with prostate cancer nowadays.
So I want to circle back to, you mentioned BPH, benign prostatic hyperplasia, or in simple terms, an enlarged prostate. How is an enlarged prostate different from a prostate cancer? Is there a difference?
There's a difference. So BPH is almost a mechanical problem because as I described it, the donut around the urethra gets larger. Often it squashes the urethra and compresses it and prevents the urine from coming out, and almost bottlenecks the traffic. The urine stream is impeded, preventing the urine from coming out. And the symptoms are often related to that. The weak stream, the bladder doesn't empty as well as it should. And with more advanced disease, it causes quite a bit of discomfort and bothersome symptoms, waking up at night and things to urinate. Prostate cancer is a growth in part or all of the prostate that may or may not cause symptoms, particularly early on in the disease. It may not cause mechanical obstruction. It may not cause pain, and it may grow. Prostate cancer by nature or by definition is more invasive in that it can spread. It can spread to different areas of the body and also spread within itself outside of where the normal prostate is. And it can cause problems as a result of that.
So
it can also, it can also decrease the lifespan of a person as a result of prostate cancer if it's an aggressive form and if it's untreated.
No, definitely. And since we're talking about then some of these symptoms that you mentioned, the weak stream, let's ask that important question. What are the symptoms that men should never ignore?
Yeah. So I'm going to first start off by saying the symptoms I'm going to mention do not mean that you have prostate cancer. Often it could just mean benign enlargement of the prostate causing these symptoms, and often it's extremely treatable. So the things to watch out for are blood in either the urine or semen, pain with urination or ejaculation, difficulty starting or stopping urination, a weak stream, frequent waking up at night to urinate. Generally, once is reasonable, but more than once starts becoming bothersome and usually has some underlying cause. Bone pain is another one, as well as weight loss in more advanced cases. If you notice any of these, you should get checked in some way or another by a healthcare professional.
Requires a full assessment. These are some symptoms
Yes.
that we should never ignore. So let's talk about now the prostate cancer. What are some of the key risk factors that we see?
So age is the biggest driver of prostate cancer. The prostate naturally does grow with time. Genetics is another strong risk factor. So there's families that have essentially family histories of prostate cancer, and often the children, the sons, also have prostate cancer if the father had prostate cancer, and it's extremely prevalent in certain families. There's some families that have varying degrees of kind of risk of the prostate cancer. So some patients may, in some families, it may skip lines. In other families, it affects every family member. Hormones play a role. So hormones cause a lot of problems in patients. In patients who have prostate cancer that may be indolent at a certain point, often certain hormones can accelerate the growth of the prostate cancer and speed up its spread, and that can cause a problem. Infections can trigger inflammation of the prostate and prostatitis. Cancer risk increases with age, as I said, and family history. And we also found that in Black and in Indian men, there's a genetic predisposition. They found that there's a link between breast cancer and prostate cancer as well, when there's a specific gene that's identified on testing. it increases the chance of both cancers in a family line. Lifestyle also matters. So obesity, smoking, a poor diet, so high red meat, low vegetables, low leafy green vegetables, as well as a lack of exercise, all worsen risk.
So if any of the listeners out there identify with some of these risk factors, maybe someone in the family had prostate cancer previously and you're currently feeling these symptoms, remember, detection is key. We've got to detect it early to try and help you. And Dr. Singh, now let's assume a patient comes in. How do we examine the prostate during a medical checkup?
Yeah, so that's often the main thing in patients' minds, and one of the main reasons why they don't seek healthcare earlier was they're concerned about a prostate evaluation. Not as bad as it seems. So examining or evaluation involves two main basic kind of parameters we look at. The one is the prostate blood test, the PSA, and the other is a digital rectal exam. That forms the mainstay of basic initial screening and evaluation. So the prostate blood test is not a great test, but it's one of the tests that we use. It's elevated when there is a problem with the prostate, which can be cancer and it can be benign prostatic hyperplasia as well.
So
the rectal exam. So, I'm sorry?
Sorry, so it's not a specific test. It can be either benign or malignant.
Exactly.
Go on.
Yes. And that shouldn't, and that's why it shouldn't raise a lot of anxiety when you get that test. What it does mean is you need further evaluation if you have an abnormal test. The rectal exam, it falls in and out of favor over the last few years. It's fallen in and out of favor, but at the moment it still has an important role in evaluation of a patient. It involves putting a finger into the back passage to feel the prostate, and we can tell a lot from the way the prostate feels. We can get an indication of the size, and if there's any suspicious nodules, or if it feels more like benign enlargement, or if it feels more like cancer. These two tests alone, though, are also not perfect, even when used in combination. And we can augment this evaluation with a couple other things. So in addition to, the family history and the risk factors and all of that, we can also augment with an ultrasound where we look at the prostate. And more accurately, we can now offer MRI scans of the prostate. So that helps to further establish if we have a high suspicion and if this is something within the prostate that we need to look at more closely and look for cancer.
So would you say these imaging studies, the ultrasound, the MRI, can that replace a digital rectal examination, or is that something that's still, as you mentioned, a mainstay?
I think with prostate cancer identification, with prostate cancer detection, none of the modalities are perfect. So with a PSA alone, you may miss disease. With a rectal exam alone, you may miss disease. With an MRI alone, you can miss 15% of disease. That may be significant. All of them together may pick up different parts of the puzzle. And in my mind, they still have not been replaced by imaging alone. There are more advanced tests available. However, those are not part of standard evaluation in terms of international literature, as well as in terms of what medical aids actually cover in terms of detecting cancer initially.
Thank you, Dr. Singh. I think that really helps to set the stage. It gives us a clear understanding of what the prostate is and the kinds of conditions that can affect it. And as we've heard, the prostate issues are incredibly common. They can appear in different forms, from simple enlargement to more serious conditions like we spoke about prostate cancer. But one of the most important things our listeners need to understand is why these conditions happen, who is at risk, and that's what we spoke about. We do have a question that's come through on WhatsApp, Dr. Singh. So The question is lack of sexual activity or lack of ejaculation a risk factor for prostate cancer?
Sure. So, in summary, no, it's not. Reasonable activity is completely fine. There's also some evidence to say that frequent ejaculation may decrease the risk of prostate cancer. The reason for that is some of the things that could potentially cause cancer are always flushed out. So in summary, no, the frequent activity or lack of sexual activity. Sorry, just repeat that again. Is it the lack of sexual activity
or lack of ejaculation a risk factor?
So not directly. There are some, there is some evidence to suggest this, but it's not very strong evidence. So I would say it would be more advised to have more sexual activity based on what is described in the literature, but it's not strong evidence. So I can't really give a strong recommendation on that, if you know what I mean.
Yes. I think it may be alluding to different conditions. I think so. We are going to move on. So the next part of our discussion, we are going a bit deeper. We're going to talk about the underlying causes. We spoke about the risk factors that make some men more vulnerable than others. And we're also going to tackle the many misconceptions that surround prostate diseases, because I'm sure you'll agree with me, too often what men believe to be true about their health is not always backed by medical fact. And that gap can sometimes cost lives. So the next question then would be, let's talk about the causes. Why do men develop prostate diseases? I know you mentioned previously the age, the family history, genetics. Do you want to just recap on that, please?
Yeah, so age is one of the major risk factors. There's a statistic that was quite interesting. With respect to prostate cancer, almost 80% of men older than the age of 80 will have some prostate cancer somewhere in their prostate. Now, this is a very broad statement in that cancer is not necessarily a cancer that will cause any effect or any negative effect on the patient's lifestyle. However, it is a cancer. And it's just a testament to how common and how prevalent the condition is as age advances. Genetics as well. There are strong genetic factors in some families that predispose to prostate cancer. And the most common gene that affects the genetic risk for prostate cancer is the BRCA gene. This is the same gene that BRCA1 and 2, the same genes that are involved in family histories of breast cancer. So we often get patients that come in with prostate cancer, and maybe their mom had breast cancer, and maybe their sister had breast cancer, and they're the first with prostate cancer, or the first detected with prostate cancer because of that genetic risk. And there may be a role for genetic counseling and looking for these problems in those patients, the specific genes, so that they can be screened at younger ages.
And that helps with the detection process. We do have another question that's come in. I'm going to try and summarize it. Essentially, what the listener's asking is, does radiation from specifically from microwaves, is that a risk for causing prostate cancer?
Not specifically. So in principle, there's certain general risk factors that can affect the genes. They're called epigenetic changes. So there's genetics that you're born with that come from your mom and dad's chromosomes. And there's genes that can be altered by the environment. So in prostate cancer specifically, the ones that are known to affect those factors are lifestyle related with diet, things like obesity, things like smoking. Smoking is always the biggest risk factor for cancer, in terms of those changes. A poor diet, so diet rich in unsaturated fats as well as red meat, and a low leafy green vegetable, low antioxidant diet, as well as a lack of exercise, those can modify the genes. Specific radiation doses from the microwave is not described. So the microwave is designed in such a way to contain the radiation that it creates, but it's not specifically mentioned anywhere in the literature regarding its role on prostate cancer. So I would say no on that one.
Okay. Well, we thank the listener for sending in that question. I hope we have answered you. And thank you also for that, Dr. Singh. There's definitely more to prostate health than meets the eye. We're just getting started. If you've just joined us, we're talking to urologist Dr. AVIKAR Singh. We're chatting all about prostate diseases and their treatments. We are going to take a short break now, and when we return, we'll be diving deeper into myths, misconceptions, and finally, treatment.
Teaching you something new every day. Radio Al-Ansar.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث أدي قال رسول الله صلى الله عليه وسلم تعاهدوا القرآن. Take good care of the Quran. Since the Quran is the book of Allah subhanahu wa ta'ala, we must always show respect to it. Always make wudu before touching the Quran and always respect the book of Allah.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. Visit our website at www.ashrafulaid.org.
Sunnah a Day, proudly brought to you by Sunpick. 100% pure sunflower cooking oil. Sunpick, cook more with less.
Sunnah a day. It is sunnah to always have vinegar and honey in one's home.
Sunnah a Day, proudly brought to you by Sunpick. 100% pure sunflower cooking oil. Sunpick, cook more with less.
Imagine this. You're putting together a 7-color meal, from the creamy pasta to the glazed carrots and flavorful onion gravy. This entire meal is made with our 100% pure extra virgin olive oil from our La Familia range, bringing outstanding quality and taste to your kitchen. Shop La Familia 100% pure extra virgin olive oil at any leading supermarkets near you. La Familia, heart of the home.
There are over 200 million orphans globally. We can't help all of them, but what if we each helped just one? The Al Imdad Foundation now gives you an opportunity to help just one orphan from Syria or Palestine. For just 500 Rand per month, you can help safeguard the dignity of an orphan by assisting them with basic needs such as food, clothing, shelter, medical care, and attention. Our orphan sponsorship program allows you to track the progress of your orphan through regular feedback. Make a difference in the life of an orphan today. Visit alimdad.com or call 0861 786 243 for more information.
Radio Al-Ansar. Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
Assalamu alaikum and welcome back to IMA Medical Files, your trusted guide to medical awareness and empowerment. I'm your host, Dr. Zakariya Ahmed Islmail, and tonight we're talking about prostate diseases, a topic that affects millions of men worldwide. And joining us for this discussion is Dr. AVIKAR Singh, a specialist urologist in Durban with a special focus on men's health. So before the break, we spoke all about the different types of prostate diseases, some of the risk factors, the causes. I want to dive deep into now the myths and misconceptions. So let's start with that. Dr. Singh, are there many misconceptions? I mean, some men believe prostate cancer is always fatal. What's the truth there?
That's completely a myth, Dr. Ismail. If detected early, the survival rate for prostate cancer is almost 100%. The problem is if we detect these things late, if we ignore symptoms, and if we don't appropriately screen, that's when we miss the boat. Early detection and treatment just saves lives and often makes the quality of life the same as someone without prostate cancer if done appropriately. So definitely a myth.
Definitely a myth. Another common myth is that prostate exams are painful or embarrassing. So men, as you alluded to earlier, men actually avoid them. What do you say to that?
A prostate exam is quick and safe, and it's usually not painful at all. If there is ever discomfort, we immediately stop the exam. And it usually means that something else is going on, and we usually address that problem. And it's just part of the diagnosis. But it's a quick procedure, and there's no reason to be embarrassed at all. This is I've quoted the stats as well. This is an inevitable part of aging. It's a very common problem that affects elderly men. So chances are you probably know probably about half your friends, if you are aging, half your friends have this problem and have gone through the evaluation. So they're just maybe not telling you about it.
And that's the stigma we're trying to break this evening.
Yes.
Let's talk about the natural remedies or supplements when it comes to prostate enlargement or prostate cancer. Are there any role for these things?
So let's break it up into the two different things. So in summary, there is a role, but it's a very small role, and you have to be very careful when using them. It's important to split the two up. So into the BPH problems and the cancer problems. So I'll start with the BPH.
Okay.
There are some supplements that are used in order to improve the urinary symptoms related to an enlarged prostate. A lot of these may help the symptoms. A lot of them some of them can help with shrinking the prostate. However, it's difficult to predict how much and in what quantity its dose is being applied. And we're not sure about the safety of that supplement. Because something's herbal or someone says it's a natural remedy, that doesn't mean it's safe. A lot of them cause problems. A lot of them make my job a lot more difficult in that it can improve some symptoms, but it can cause more problems. So it can also make
the situation worse.
It can make the situation worse. It can make the diagnostic tests a lot more difficult to interpret. And we have to just be careful when using it. So I would avoid them until you are evaluated by someone first. And that healthcare professional, ideally a doctor or a urologist, recommends a specific herbal remedy that may assist. Taking one on the recommendation of a friend or the media, or just finding one over the counter, I would caution against that. With cancer, it's even worse. Cancer really can be so often. So I mentioned that you can get BPH and you can get prostate cancer. In some patients, you could have both. So you could have a big prostate with a spot of cancer in it.
Okay.
And often the reason why some of these patients seek help is because they have symptoms because of the BPH, and we find the cancer. The problem is, if you treat those symptoms before you are properly evaluated, you may think that the problem has gone away and there may be cancer brewing beneath the surface.
It's almost a disservice to yourself.
100%. 100%. And often we find that these are, just from my own experience, not specifically, in the literature, these patients are often more advanced, or the disease has progressed a bit more because we tried to temporize it with these other modalities that weren't the correct, weren't the correct treatment options. And you make the situation worse.
I think before we run out of time, I'd like to touch on the treatment options. But before I even ask you about that, with regards to prostate cancers, why do some of them grow very slowly while others are aggressive?
Yes. So that has to do with the specific biology of the tumor.
Okay.
Prostate cancer is not just one type of cancer, it's a whole spectrum. Some of the cancer grows very slowly because it's only slightly abnormal compared to normal prostate. And other types grow very fast because their biology is such that there's a lot of errors within its programming, basically. So cancer develops when the body's normal measures to keep things under control don't work. And basically, when cells are dividing, there's supposed to be a check where we make sure that there's no mistakes happening. And just say, for example, you have a skin cell. If you lose some skin and you develop more skin cells, they're supposed to come out exactly the same every time. Occasionally, when there's occasionally mistakes happen in this programming, and the second cell that's made is not the same as the first one, and maybe the one after that is a little bit different from the second one. And what happens with that is the end point, the last cell, maybe the 10 cells down the line, looks nothing like the first one, and it behaves nothing like the first one, and it grows without any kind of regulation. So with prostate cancer, the lower risk or lower grade cancers have a few mistakes, and it's only slightly different from normal. With the aggressive cancers, there's a lot of mistakes, and it's very aggressive, and it can do whatever it wants, and basically we can't predict its behavior, so it can spread from one organ to the next. So that's a very complex question to answer, but essentially that's basically it. It's more abnormal than there's a range of abnormality with respect to those the biology within those tissues. So it ranges from very non-aggressive disease, very indolent behaving disease, all the way to very aggressive disease that spreads like wildfire.
I think you've packaged it quite nicely. Some really important clarifications there. Remember, prostate disease, listeners, is not a death sentence. Early detection, awareness about these symptoms, and action are key. And if you've just joined us, this is Medical Files. We're talking to Dr. AVIKAR Singh, specialist urologist, and we're talking all about prostate diseases. We are now going to speak about the treatment options. So, Dr. Singh, if someone is diagnosed with prostate cancer, what are the treatment options?
So when someone's diagnosed with prostate cancer, it's important to first stage them. So I talked about the biology and the aggressiveness, but it's important to know how far it's gone. Okay. And that's what staging is. If the prostate cancer is only within the prostate still, then we call it localized. If it's spread to the other organs, we call it metastatic. And prostate cancer has a tendency to like to spread to the bone, and it can cause bone pain and things like that. And there's different treatment options depending on those two factors, those two parameters. So the aggressiveness or the grading, that's what we call that. So if it's a very, very indolent behaving disease compared to aggressive type of disease, and then how far it's gone. So the staging, that's how we determine whether it's localized or metastatic. But with those two components together, we decide whether we should treat only the prostate or treat with medication that covers everything in the body, essentially systemic therapy. If it's spread, usually you need to give some systemic therapy, so it covers everything. It's not always chemotherapy that I'm referring to, but it's medication that affects the whole body, and it can treat the cancer. So with prostate cancer, there's been amazing advancements with both forms of management for the localized disease, the early disease, as well as for the cancer that's spread. And the localized disease, to emphasize, the localized disease when detected early is usually completely curable. I won't spend too much time on the modalities of treatment, but the broad categories are or prostate cancer that is localized are surgery, where we essentially remove the cancer with the prostate. And we can do that very accurately nowadays with the use of robotic technology. And we can preserve everything that needs to be preserved and remove what needs to be removed. So we're fortunate, and that's through keyhole surgery that we do that. The other option is radiation, which depending on the type, the ideal form is something called brachytherapy, where we put tiny little seeds into the prostate and it emits some radiation that essentially kills the cancer. And it's also quite an amazing modality in that the patient can go home the same day. There's obviously pros and cons to it, but it is an amazing modality for many patients.
So these, sorry to interject there, but these modern treatments, they sound great. How successful are they in treating prostate cancer?
Yeah, so if used for the appropriate, cancer and patient, they usually, it depends on the specific types, but generally there's a very high success rate. The point of this treatment is not to, when localized, the surgery and radiation, is not to just keep someone alive. This is cure. The intention of this is cure. So we are removing or killing the entire component of cancer that the patient has. Otherwise, we generally would not offer those options. So in summary, it's very good. It's very effective. And the goal is cure, to completely eradicate all cancer with those options.
And essentially go back to leading a normal life.
Yes.
And with these... yes, go on.
Sorry, Dr. Ismail. There's one modality I didn't mention, and that also has become more popular, in the last few years. It's something called active surveillance. So in some cancers that are not aggressive, that are localized, we can opt for a very conservative approach where we only intervene if and when necessary. There's a few subtleties to the strategy, but it works very well to preserve a very good quality of life in many men. So that's also something we can offer in the right patient. Every modality has its role. So we have to individualize.
And yeah, like you said, it depends on each patient is different, and it depends on the type of cancer they have, and try and individualize a treatment package for each different patient. But let's talk about the side effects then. Are there any side effects that men should prepare for with using these treatment modalities? Specifically things like incontinence, erectile dysfunction.
Yes. So I'll start with the surgery. So surgery has, because of what we are doing, there's a risk of an effect on the erectile function. So with all of this, we're talking about prostate cancer. This is in the context of prostate cancer. We're not talking about of the benign conditions. That's often less complex, but I'm specifically talking about the cancer. We can talk about the BPH afterwards if you'd like. But with prostate cancer, the effect on the treatment, the surgery, the removal of the prostate can affect erectile function as well as urine control. Now, in the past, this was a lot worse than how it is now, and that's because we have access to really amazing technologies where we can preserve these structures. It's not perfect. They can still be affected, but it allows us to preserve them and improve those the rates of those problems quite a bit. That being said, those problems are manageable. So the urine leakage can be managed, erectile function can be managed as well. Radiation, you can go home the same day after treatment with brachytherapy, which is those little seeds we put into the prostate. And for the majority of patients, they have no symptoms. But in some patients, they may have some urinary symptoms which are a bit stubborn to treat. Majority of both those treatment modalities, though, the side effects are manageable. Remember, we're not doing this for benign disease also. This is for treatment and cure of cancer. So a certain amount of side effects are understandable, but the advantage is with what we have access to now, the side effects are also manageable.
And like you said, these are the treatment options for cancer specifically. But let's touch on just very, very briefly, the management of benign enlargement of a prostate.
Yes. So benign enlargement of prostate for patients with mild symptoms, so just slight urinary symptoms, but not too bothersome. It's just something we noticed, we detected, and the patient's not too unhappy, and it's not causing too many problems on their body, kidneys and bladder and things like that. We can often institute lifestyle changes, just reducing caffeine, reducing their fluids at nighttime, trying to train the bladder basically with a couple maneuvers that we suggest. As the symptoms progress a bit more, medication is an option to open things up. There's a couple different types of medications, depending on the disease specifically that the patient has and the ability to tolerate the side effects. So some of them do affect hormones. And if that's a problem, then we occasionally move to the next option, which is a procedure, either minimally invasive or a surgical procedure, for which we have excellent results. So it ranges anywhere from injecting water vapor into the prostate to shrink it, all the way to scraping out the prostate, the part that's causing a blockage, which is done in theater under anesthetic, all the way to putting in stents that open that area up in patients who can't tolerate a very big anesthetic or very significant anesthetic. There's several options available. Each one has its role, and they're very effective. When scraping out the prostate, we can also use a laser to do it, and all these options offer the scraping out the prostate procedures. The TURP, which is a resection of the prostate, provides long-lasting relief without the need for long-term medication.
And is this a long-term treatment option? Does this come back? Does it grow? Does it enlarge again?
So generally not within the lifetime of the patient. It can start to grow, generally 7 to 15 years. Within 7 to 15 years, it starts to grow. But remember, when you have a 45-year-old with an enlarged prostate, that's been growing for 45 years.
Right.
So you need quite a long time for it to grow to the point of blocking again. Often you tailor according to the patient. So often when the patient's younger, surgery is an option. You scrape the prostate out so you can avoid the side effects of some of the medications, which are sexual in some of the patients. And later on, if they do have problems, or in older patients, we offer some of the medical options, bearing in mind it may have some impact on the sexual function and things like that. But each patient's individualized. If depending on what their specific goals are, we tailor a treatment option for them.
I think before we wrap up, Dr. Singh, what's the one message you want men to take away about prostate health?
So prostate disease is extremely common, but it's treatable. The key is early detection. Don't ignore the symptoms. Don't be afraid to ask for a PSA test if you're over 40 and at risk. Talking about it openly can save lives, your own life or a loved one's.
Thank you, Dr. Singh. I think that was an incredibly enlightening discussion. It's clear that prostate health is not just only about aging. It's about awareness. It's about, as you mentioned, early action, early detection, recognizing those risk factors and seeking help. And, of course, maintaining an overall well-being. Unfortunately, that does bring us to the end of tonight's show. Heartfelt thank you to Dr. Avikar Singh for joining us this evening.
Thanks for having me, Dr. Ismail.
Sharing your expertise. Pleasure to have you. And to our listeners, prostate health is men's health. Don't ignore the symptoms. Don't delay the checkups. Early detection saves lives, and silence can cost them. Catch us again next week on the Medical Files as we continue bringing you health topics that matter. I'm Dr. Zakariya Ahmed Ismail. This was Medical Files, brought to you by the Islamic Medical Association of South Africa. Until next time, take care of yourselves and each other.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Ansaar will be held responsible for any ill health